There we go. So welcome again. And let me introduce Nathan Rumer, who will be our guest talk show tonight. You might recognize him from when the days when he was a reporter at BC Catholic, attending to many different stories around town of interest. So take it away, Nathan.
All right. Well, yeah, thank you, Annabelle. And tonight we got a great discussion about fertility health awareness and why it's an important for young adults to know about it and learn it. So we're joined by Heather Patel and Maria Bozeki.
Oh,
there you go. And a few other guests that'll be popping in to be sharing about their experience and some insights. So yeah, welcome everybody, and hope this is a great discussion. So we'll be going over a few discussion points. Heather will be discussing more in depth about her particular method of fertility health. And after that, we'll have about 30 minutes for questions and answers. So that's kind of how tonight's event will get going. So without further ado, I guess we should get started. First question, what is fertility health awareness?
Do we have maybe bios about us available where we
in terms of a
going to introduce ourselves?
Yes, you can just elaborate further.
Okay.
I forgot to.
Okay, no problem. Okay, we'll do it on the fly here. My name is Heather Patel, and we'll learn a little bit more about my story in a minute. But I'm a brand new practitioner. I have gone through the in-depth study and the accreditation of this program as a certified practitioner. I am a mother of twin boys, and they're 3 years old. And I do this sort of as a part-time gig, and my full-time gig are my twins for the most part. So that's my involvement. Mary Ellen, did you want to introduce yourself?
Sure. I'm Mary Ellen Haggerty. I'm a physician, a family practitioner in Edmonton, and I'm a certified Napro technology medical consultant. So I practice some of what I'm going to be talking about in terms of knowing your fertility and then using it to treat some conditions that especially are particular to women or to couples. Yeah. And I've got 6 kids and 14 grandchildren, so I'm a little older than you are. So I've been in this business for quite a while.
Wow, wonderful. Maria?
Well, my name is Maria Bozeki, and I am a clinical pharmacist. I have been practicing a long time here in Alberta, originally from Saskatchewan. And my background is in poison and drug information. I am a specialist in that area. The other place that I am trained in is within fertility care and Napro technology, similar to Dr. Haggerty. So yes, I'm a certified practitioner as well as a medical consultant in this area. So I'm here to help bring you my perspective on this area, and just let you know a little bit more about this medical model that can help women to be treated cooperatively and restoratively for their fertility health.
All right. Well, thanks, Heather, for jumping in. Totally, yeah. Introductions are very important. Yeah. Who is speaking to us tonight? So sorry about that, but
not a problem.
Yeah. Well, this is great. Yeah, we've got a very talented group of people to be able to speak on things. So again, maybe Heather, if you want to take it away again to discuss what is fertility health awareness.
Sure. Yeah. Thank you. So fertility awareness is the ability to know more about your overall health by charting your cycle. And so it's really a game changer for most women who want to learn more about their body and their health and be able to advocate for themselves when looking for appropriate care or treatment.
All right. And yeah, so what brought you to learning about the fertility awareness methods?
Yeah, so I've actually been using the method for 8 years. So 3 of which I learned while I was a single professional. And so it all started when a girlfriend of mine, we were probably young, about early 20s, and she was experiencing some severe pain. And so a practitioner approached her and said, "Hey, I think you should try charting this and figuring out sort of what might be going on with your cycle, and sort of pinpoint what areas are troublesome and perhaps get treatment for it." And so it did end up that through her charting, she was able to realize that she was experiencing symptoms of endometriosis. And so she was able, through a program, to know that knowledge and get treatment, have a less invasive surgery that, allowed her symptoms to be better tolerated, and also to preserve her fertility. And now she's on to her 4th baby, pregnant again. So that really got me thinking. I said, why are they talking about mucus? Why are they talking about all this cycle stuff? And I felt left out. So that's how I got into the game. And I thought, okay, I got to figure out this because, I feel left out. And so fast forward, 2.5 years later, I met my fiance, now husband, and I decided to pull him through and say, let's learn this together. Let's, achieve or avoid whatever our wishes are for that time period, and just learn about the cycles. And what we came to understand was that I may have some trouble conceiving in the future once we're married. And so with knowing that knowledge, which was helpful, we got married, everything was great. And then I had a major hormone imbalance. So my hormones took a turn for the worst. And I was able to know from my practitioner that there's this woman named Maria, and that she was ready and eager and would help me if I needed help with my cycle. And so there was a couple months of sort of, disappointing negative pregnancy tests. I was feeling a lot of major symptoms. So nausea, severe fatigue, weight gain, bloating, all the really uncomfortable symptoms of pregnancy without the pregnancy. So it was very frustrating. And so what our aim changed to, so it went from, let's not try to have a baby right now, let's try to make Heather feel better. And so that's what we did. And so we hired on Maria, and she really walked us through what was going on. And so we've been trying to conceive for a year, and 7 of those we went through Maria and her treatment, and were able to sort of treat my hormone imbalance. And so, I want to have some sharing ability on my screen. I don't have a sharing ability, Annabelle, if you don't mind. And so I was able to then conceive twin boys. So, and I've got a little image of them here. And so you have here every gestational area here. You got Lawrence and Gabriel. And so they're about 1.5 years. And this is them at 3 years old. And so I really was very hopeful with what we were able to do with treatment, because I was not able to conceive without the help of Maria. And so I think that really inspired me to get more answers. I had seen my doctor. I had told him that I was having these issues. I was trying to advocate for myself and say, hey, I want to look deeper into this. And my doctors were not helping. They wouldn't participate. They wouldn't help me. And they were very quick to give me the birth control pill. Which to me just did not make sense, since I obviously wanted to get pregnant, right? So that didn't make a lot of sense to me. And so I said, this sucks, but I'm going to move on and try to find a doctor that's going to help me. And so unfortunately, that's the case here in Canada, really is having this ability to, and we'll talk more about that later. So really wonderful. I was able to conceive and double the blessing, being twins, because we really did work hard to get them with this treatment plan. And really that's what gave me this motivation to teach this, to learn it and to share it, because I know that there's couples out there that cannot conceive without proper help and without proper treatment. And so, I did my training, my 13-month practicum, sat a 6-hour exam, very grueling. But it was, it's in order to sort of share that hope with couples and young women that there is help and there is treatment available to them should they need it. And so, the message really is that, us women, we're smart. We need to ask more questions. We know our bodies better than anyone else. And we have to be able to sort of articulate that. So that's a bit of my story.
That's great. And I guess just for clarification for tonight's session, there are different methods of fertility health that you can partake in. Also, I think that's the term is not natural family planning, more trying to move to the fertility health saying. But yours in particular, do you want to explain the name of it and what differentiates it a bit from the others?
Yeah, exactly. Yes. So we are trained with the method of the Creighton model fertility care system. And that was, developed by Dr. Hilgers out of Omaha, Nebraska. And so our particular method is piggybacked off Billings. And so, and it's sort of made better in a sense. And I guess I'm being biased with that. But there's an added science that he has put to really enhance the model and actually treat women who have more complicated situations, such as infertility, such as PCOS, and even other cases like that. So that's a bit of what separates us. But we're all sort of in that same realm of fertility awareness, and it's all about knowledge. And so that's our particular model.
Yeah, that's great. And real personal touch there and how it's kind of worked for you. So a true believer when you're teaching it to people as well. So it's always a good thing. So let's maybe move on to, what does in particular the Creighton model look like? Like what is charting, and just kind of go into exactly how the process works.
Yeah, exactly. So I'll give you a little bit of a quick version. And so as I'm sharing my screen here, we've taken excerpts out of Dr. Hilder's Creighton model intro session. And so we're not going to go into large depths, but I just wanted to recognize that this is, of course, we haven't made this up. This is coming from the expert. And so, so there's two real parts to this fertility awareness. It's the fertility care. So it's the ability to chart what you're seeing from your natural biomarkers, which is cervical mucus or the absence of cervical mucus. Okay. And so you're charting that, and that should, of course, give you fertility appreciation, right? To know what's going on with your body and be empowered by that. The second part to it, which is that added bonus and that added wonderfulness of the program, is the Napro technology. And so this is over 30 years of reproductive science that works cooperatively with the natural procreative cycle. So really, we chart what's going on with their cycle, and then we check out what exactly is going on, and looking specifically at hormones, and kind of putting that into the element of things. And so the Napro technology is really looking at the core problem. What is it that's causing you unusual bleeding? What is it that's causing you long cycles? These symptoms that you're experiencing. So it kind of it dives a little deeper, and it really essentially is giving you answers. Okay. The why. And so I'm going to simplify this a bit, but it is not as simple as I'm explaining. And I want to just give a disclosure that, we want to learn this and we want to learn it with a trained professional, which is a practitioner. Okay. And so there's a lot more to learn than just, going through what we're looking at here. But I want to just give you a synopsis of what does charting look like and what are we looking for? And so we have a menstrual cycle, which is this full length cycle here that we see. You can see my mouse here. All right, we always start with the menstrual cycle. And so that is an average of 3 to 7 days for most women. Okay. And so bleeding is what we put a stamp on for red, right? So that identifies red, and that's heavy. Okay. And so red goes with, of course, the bleeding. And so we have here that this person has 2 heavy days, pardon me. And then you have moderate for M. Okay. And then it goes lighter. Okay. And so she's just documenting what she's seeing here. Then she has an absence of bleeding, okay, which is where she'll notice dry days, okay? And so you have those written out there, and we identify that with a green stamp. Then we go into the characteristic type of discharge that we will start to see. So as the estrogen increases in your body, the more your body is going to create this mucus and it'll progress. So it'll start as a sticky, small bit of mucus that's cloudy in color, and it'll get to sort of a longer length. And then it'll start getting clear, stretchy, or lubricative in sensation. And so that's that ability where, the estrogen reaches that really good peak. And so you see how you have a white baby here labeled with a P. Okay. So that sort of identifies, gives us a really good indication of where ovulation is occurring. Okay. And we'll go into a bit more detail about what, a not normal ovulation might look like. Okay. So, but this is sort of a healthy cycle. So then we have sort of that the last day of anything that's clear, stretchy, or lubricative is what we identify as the peak day, which is around the day of ovulation. Okay. And then you have, followed by that, you got day 1, and it goes back. There's a drastic change in the mucus, and it becomes like a small little bit of mucus again, similar to the day 10 here. All right. And then again, an absence of any discharge, which is dry. And then, 2 dry days here, and they also have a green baby stamp. So what we know is that women could ovulate up to 3 days long. Okay. Which is why we have this window of fertility following the peak. Okay. And so this woman's full fertility window would be from day 10 to 17. Okay. So following that, we usually get, now the progesterone surge, which is sort of a dry stage that you would experience. And so you have here a dry day, and then it's with the green stamp there, and it continues on until your next menses. So that gives you a little bit of an idea of how you would chart, and it gives you an idea of where the fertility window is and where you're infertile, okay, with your dry days. So this is a diagnostic chart, meaning when we chart, it's telling us, what is actually going on? What's the pattern of our health hormone wise as we chart? So as you can see, this person, slightly different slide, a little longer menses. You see here that in the black bars here, this is where the estrogen is increasing. And so you see that correlating with this mucus discharge that's happening up here. Okay. It reaches a peak and then it dips down. Okay. And then a new predominant hormone kicks in on the gray bars up here. And that is progesterone. That's the other important hormone that is very important to have. They're both very, very important. You need to have a balance about it. It's like a yin yang, right? You have to have one strong and then the other strong as well. And of course, when you have an unhealthy cycle, there's something off with both of those hormones. Okay. And so the progesterone reaches a high, and then it dips down for menses to happen again. So for the pattern to continue. Okay. If you maintained a pregnancy, your progesterone would stay at high, maybe dip a little bit, but it would stay high. Okay. And so that's kind of the gist of how the hormones, how your chart can be linked to your hormones. And then, that's where sort of the bridge to Napro becomes, is understanding exactly what your hormones are reading, whether you're having a healthy ovulation, a healthy post-peak phase, which would be that sort of progesterone area of your cycle. And so both very, very important. So the advantages of this model, it's medically safe, it's proven reliable, it's comparatively inexpensive when you think of couples or women who are seeking sort of artificial means, right? IVF, IUIs, etc. So it's natural and cooperative. So it works with your body. We use bioidentical hormones that really trigger your body to produce more of what it should be producing. And it's really a shared system. It respects the dignity of women in marriage. We really articulate marital bonding because a lot of our competitors, or not competitors, but other clinics, for artificial means, are a bit of a strain on marriages. So we really want to focus on that marital bonding, and it's standardized. So the language, the key that we teach you, the descriptions that are taught, it goes across the globe. And we've got places in Singapore, we've got places in Brazil, Nigeria, et cetera, that are teaching this, Australia as well. And so it can really translate anywhere. So I think that's more or less it from my side of things with that question. There you
go. Great. That's a great intro into there. A lot of crossover. I mean, not this. My wife and I use a slightly different method, but it's obviously these are all very good, and now we're going to get kind of more into the nitty gritty of cretin and Napro. So what can charting tell a woman about abnormalities with her cycle? And I think, Maria, that's where you want to explain that. Oh, you're still muted.
Thank you. I said over to me. So thank you. I'm going to just elaborate on a couple of slides here, just as it pertains to what we call Napro, or Napro technology, which is a short way of saying natural procreative technology. So again, I am trained as a clinical pharmacist and medical consultant. I am with Fertility Care Calgary. I have been there for the past 10 years, and I have been seeing women, not only single women, but also many, many couples who are seeking to have children. So because this venue is focusing in on the younger set of women out there who are just sort of getting to know what's going on with their bodies, I want to encourage you to always be an advocate for yourself. From right now, at this young age, it begins now. These are skills you can learn, interactive skills with your healthcare professional, who is your primary care physician or pharmacist or whoever that might be. I want to validate that you can listen to your body, and it will tell you a language of its own. It will tell you what is happening. You don't need somebody to tell you what's going on. It is very easy with the charting appreciation or fertility appreciation to understand that. And so I say that the charting is really a way to translate that language of what your body is telling you. And so for many young women, they think that a Band-Aid solution that they are being offered is the only option for them, but it's simply not true. I would like to give an example of a woman that I met recently. She was in her 30s, and she's infertile. She's having trouble trying to achieve. And we were talking about her medical history, and she said, yeah, when I was really young, I ended up having really painful cramps, and my cycles were irregular, and the doctors put me on birth control when I was 12 years old. And she had been on it up until a couple of years ago, where she had gotten married, and then she wanted to try to achieve pregnancy. So it definitely played a role, because we know that under the age of 25, birth control is very, very dangerous to the normal reproductive pathways. They get out of whack when you introduce something synthetic, and especially if it's taken over a long period of time, it can be very, very difficult to undo that. So we never advocate for those Band-Aid birth control solutions. We are always advocating for something that is natural, cooperative with your body. It's restorative. It's just restoring the levels back to where they should be. So Heather, maybe that slide could come up, that slide number there, which talks about Napro technology, and then I can point out a few things on it. Is it possible to bring that up? Terrific. Okay. So when we think about how can Napro technology, how can fertility appreciation and charting help me? So really, Napro is something that helps you monitor, maintain, and evaluate your health your whole life long. So this isn't something you learn today and then you use it for a year and you're done with it. This is something you use your entire reproductive life. And the beauty of that is that if you uncover any kind of problems, you will have the ability to change that and treat your health long-term, so that these things that you found at a younger age will not affect you later on in life. And I see that repeatedly in my patients, and I'm pretty sure that Dr. Haggerty has seen that a lot as well. So the time to treat yourself is when you are young. The time to learn about your cycle is when you are young, because it will serve you well the rest of your reproductive life. This is an investment in your health. This small amount of time, it takes 10 minutes a day to do this, but that little investment in health is worth its weight in gold. So when we talk about the things that Napro can help, I've sort of pointed these out already, things like infertility, miscarriage, maintaining a pregnancy. So meaning we want to prevent preterm labor. We want to prevent any issues from happening that could happen before the baby is term or full ready for delivery. Irregular cycles are a very common thing that we see women for Napro technology. So by that, I mean, well, maybe you have a cycle that you only get a few times a year, or every 2 months instead of every month, which would be a normal, regular, healthy cycle. Those are common things we would see in situations like polycystic ovaries or PCOS, as some people know it as. Napro uncovers all sorts of hormone problems. There just isn't enough time to get into all of these sort of intricacies, but if you are in the program, you will learn about them, of course. PMS is a huge thing. PMS not only affects the single woman in how she interacts with other people and how she feels about herself and her quality of life, but I also see how PMS affects married couples. And believe me, the men always know when their wife is, in that stage of her cycle where she's struggling. And so this is what we're talking about when we're bringing in the men into the program, if you are married, and helping them to be a part of that and building that relationship, because it can be tough. Ovarian cysts, there's all sorts of different types of cysts that can be identified and easily treated with this. Unusual bleeding, that is something that commonly comes up because women will notice it. Women, when they have unusual bleeding in their cycle, they notice it right away because it's not normal. They know that. And so those are commonly things we see in irregular cycles. And So when these things occur, it's important that you have the right trained professionals in place who know how to interpret this and then know how to get you treated. We always want women to know that they have those options. And the last thing that Napro also addresses is the effects of stress, because stress definitely makes an impact on our fertility, on our ability to naturally have an ovulation and benefit from the hormones that relate after ovulation occurs. Stress can really impact fertility and trying to achieve. So really what we're trying to do is address the short-term issues that are at hand right now, what is affecting you, what's affecting your quality of life, but also what is going on that could affect your long-term health and that could make impacts on your choices later in life. So maybe right now you're single and you just want to get your irregular cycle looked into and you want to feel better. But by doing so, you will do yourself that favor of later on in life, preserving your fertility and making that time in life much easier. So if you could just go on to the next slide there. What I will touch on next is just a variety of unusual charts. So Heather went through with you what a normal chart should look like. And I think that, you should be able to tell quite easily, just from memory, how different these are from a normal type of chart. And so the top chart shows you someone who had infertility. As Heather mentioned, usually there are somewhere around 6 to 8 days of mucus that should be present in a woman's cycle. Sometimes there's less, but in this case, she only had 1 day of mucus. So the less mucus tells us something about the health of the ovulation, the health of the cycle. And of course, it for this woman was what we noticed was causing her infertility. So then we would treat it accordingly. And as far as miscarriage goes, that one, very easy to see that the second half of the cycle is quite short. So after that P for peak day or ovulation day, it's quite short. That just indicates that she's struggling with her hormones and there isn't a good hormonal foundation for her to go on to have a successful pregnancy. And you may not even know that you were pregnant to begin with in a case like this. Low progesterone, the next chart, we can see that this is a chart with unusual bleeding. Remember I said, oh, it's really easy to spot. And it is. So you can see there's all that funny bleeding happening towards the end of the cycle. It's brown for B, and then VL means spotting. So what we know from the research is that when there is 2 days or more of this unusual spotting at the end of the cycle, it's highly suggestive of something called endometriosis. So that is something we would investigate. As far as endometriosis goes, we would ask women questions like, do you have super painful periods? Because if you do, it's a reflection that, yes, endometriosis may be present. And there's other symptoms that would go along with that. But if you are one of those women who struggle with quality of life at the time of your period because you are in such intense pain, it's a red flag. It means you need to talk to somebody about it. You need to see, likely get a referral for an endometriosis surgeon to investigate it. The last chart that I want to point out is something that we would see in a number of different cases. Women later in life in perimenopause, meaning now they're starting to gear down and stop having their period. It could be a woman who has unusual hormone balance, fibroids, polyps, things like that aren't normal. Could be cysts involved as well. And really, anytime something like that is seen, it requires a physician visit and a pelvic exam and making sure that everything is okay. It's also a pattern that we would tend to see with something like polycystic ovaries. And I want to point out that with polycystic ovaries, we see those irregular long cycles. We see unusual bleeding, acne, problems with weight, blood glucose and insulin issues. So those are things to look out for, ladies out there. And I also want to point out the PMS symptoms that would go along with that, probably with the low progesterone, actually with all of those charts. In fact, PMS would be highly likely. Things like mood changes, irritability, feeling bloated, food cravings, depression, headache, crying easily. Those PMS symptoms that happen, in the period of time right before the next period is supposed to arrive, or before the period is going to arrive. That's that PMS period of time. So I want you to think about those things, think about if they're happening in yourselves, and, just knowing that there is help for you, I think is very, very important, and know that you have options other than Band-Aids in these kinds of situations.
Whew, that was an extensive look at really breaking down the different variances of a woman's cycle. That's pretty in-depth stuff. Looking forward to talking about why nobody knows about this. Seems pretty in-depth to me. But anyway, we'll get there. So we know the problem. How does Napro work to restore a woman's cycle? I think, Maria, that was something, or Heather?
Yeah.
Yeah.
Maria, go ahead.
Oh, is that for me? Okay.
Yeah.
So how okay. So as I had mentioned with Napro, with restoring the cycle. So when we say restoration, what we mean is that we're not, we're cooperating with the cycle. We're not doing anything that the body would not already do on its own. We are bringing the levels back to where they should be. So I like using the example of, say somebody who has diabetes and they need insulin. Everybody knows what insulin is. It's there to help control the blood sugars. And when diabetics take insulin, they have a very specific dose they take. Why do they take a very specific dose? Because they need to restore their levels back to where they should be. The same thing would be for something like thyroid hormone. Many people have heard of thyroid hormone. Sometimes you have to replace it and put a specific amount back in your body so that your body is now normal. It works on the same premise with Napro technology and with the way that we treat women. We also restore the hormones back to normal. But the question becomes, how do we do that? Most people don't understand that. Well, Dr. Hilgers, over the past 40 years, of course, put together the charting, but for the last 30 had put together treatment protocols based on the charting, and not just treatment protocols, but evaluation or what we call targeted hormone assessments. So according to the chart, we know when to go in and measure the hormones at specific times. We get a nice profile done. And when we look at that, we know how to interpret it and say, aha, she needs to get this much on these days of her cycle to bring her back to normal. And it's really amazing how when women have been abnormal for so long, or suboptimal, I should say, with their hormone levels, when they feel normal again, and when we restore those hormones for them, it's an amazing transformation. They just go, wow. And I can tell you this because I'm one of those women like Heather. But that transformation you make where you go, this is what it's like to feel better. This is what it's like to feel normal. I had forgotten hormones are so powerful. And so I think that that's the beauty of having not only a charting model, but a treatment and assessment model that work hand in hand to help you restore your fertility health. So thank you, Nathan.
Of course. Well, it's a great blessing. I mean, people refer to some of these fertility health systems as a way of either naturally having children or avoiding contraception and stuff like that. But to get that next level where you're really working with women, and I'm sure these types of irregular cycles, these types of variances are more common than people think, especially for us men who really don't know. I mean, I don't know half the things about a woman and her cycle and just pregnancy in general until we had our first child. And it's just absolutely astounding that, these are the things people have to deal with. And it's great to see that there's things out there. So do we have Miriam here for so we have a testimony, kind of a personal story about the cretin and Napro and how it's worked for her. So Miriam, if you want to take that away for us.
Hi, so I'm Miriam Porcelato, Maria's daughter. So I'm just gonna kind of tell you about like my experience with my endometriosis and PCOS and just how it affected my life, and also how treatments just helping me with the negative effects that it has put on my life, and just how it's important to kind of stop it, or not stop it, but treat early on. So basically, when I was 17, I got diagnosed with PCOS, and then later I had surgery where we found out I did in fact have endometriosis, but it was way before that I was feeling the effects of both of those. Probably when I was around 13, I was getting horrible cramps, and I would be in bed for 2 to 3 days at a time. I was missing school because of it. I was missing sports activities. I couldn't make plans with friends because my cycle was so irregular that I didn't know when to expect it. So I basically had to wait until immediately after my period ended, because that's the only time where I knew for sure I'd be cramp free and pain free. So it just really started affecting my life, and it was making everything really difficult. And it definitely did have an effect on my mental health, because especially with PMS problems, but just not being able to do the things I wanted, and not being able to like do schoolwork as well as I wanted to, or being able to go play sports. I would miss hockey practices and games. I'd had to go home in the middle of games or practices sometimes because it would be that bad. I was on a lot of painkillers. No amount of painkillers or heating pads or anything was really helping with the pain. And so we finally got me treated. We got the laparoscopic surgery. And after that, I've found my cramps are significantly less. Like now just a single Tylenol is helping if there are any cramps for that month. It's really helped a lot. During my first year before I went into university, I was really worried about falling behind in those classes because it's university. So those ones are a lot more important than say middle school or high school. So I was horrified that I'd be missing classes that I'm paying $700 to be at for each class. And so it was really nice, like hearing that there was something I could do about the issues that I was having. And so I think it's just more important for young girls to realize like that the sooner you get treated, the better. And a big problem is that my doctor, I told them what was going on, and they immediately tried to put me on birth control. And knowing the horrible side effects that birth control can have, especially on young girls, I obviously said no. And so I think it definitely has made it easier for me to get treated for this. And I think a lot of people need to know the dangers of birth control and how it can make your infertility problems harder to treat and just overall worse. I have multiple friends that are on birth control right now, and they tell me like all their problems have either not gotten any better or they've actually gotten worse. And so it does make me worry a lot for them, because if they continue down that road, they're going to have the same problems, and they're going to end up having even worse problems down the road. Like with PCOS, you can have breast cancer or ovarian cancer, or diabetes. And the sooner you kind of put a hold on that by treating, like, the better. And so, especially since it's hereditary, because a lot of people on my dad's side of the family have it. That's why I have it. My grandma had it. She ended up dying of breast cancer because she had endometriosis and PCOS. And so it's definitely prevalent in a lot of my relatives, even the male relatives, with metabolic issues and stuff like that. So yeah, it's just, the sooner you catch it, the better. And just, I am happy that now I know I'm going to be able to have a better quality of life when I'm older. I'm not worried about getting a certain type of cancer or something like that, or having a heart attack or having heart disease or something. So it is really reassuring to get the proper treatment early on.
And Miriam, you would just say, since going through the treatment process, your quality of life, it's much more easier, a little carefree.
It's a lot easier. I don't have to worry about, like, oh, someone invited me to go to something. Am I going to be on my period that week? Because I'm not going to be able to go. Like, that's what it used to be, because I would be in bed for days, just kind of curled up in pain. And now it's like, yeah, I don't have to worry about it anymore. I can just kind of go with it. It's easier to manage. So it's really nice.
Yeah, and well, that's a great story, and great to hear that. Again, this isn't just a method for couples looking to maybe get a better shot at tracking so they can get pregnant or naturally postpone pregnancy. But this is here helping a young woman who wasn't even thinking about kids, just dealing with what a lot of women probably do suffer with irregular cycles and those types of complications. Which kind of brings us now to our dear old medical system. So, this kind of, a lot of people on here are probably familiar in some form or fashion with fertility health, and may not find it weird or different. But I could tell you from friends and family who are outside of my religious bubble, it's not. This is a foreign concept. This is something that is weird outside the establishment, and so what are the challenges that women are facing in Canada to get the reproductive medicine and to actually heal without, seems to me, and correct me if I'm wrong, sounds like every doctor's is like, well, pop the pill. So whoever wants to grab that one, go ahead.
It's probably a Dr. Mary Ellen Haggerty's question. Is that right from memory? Heather?
Yeah. Yep. Or Maria, you guys can both have some insight into that.
Okay. Am I unmuted? Can you hear me?
You are.
Okay, great. So my question was, what I'm supposed to answer is, how did reproductive health care change with the invention of the oral contraception? So I just wanted to comment on that question, because I actually wasn't practicing medicine before the pill was legal, because at one time it wasn't legal or even widely used, but I was practicing shortly afterwards. And I can tell you, when I was in high school and university, I didn't know anything about a birth control pill. It wasn't until probably in medical school I learned a little bit about the birth control pill. It became more common in the late 60s, but it wasn't even that common then. It became very common in the early 70s. And what happened with the pill, when I was first in practice, I'm sort of giving away my age. I guess I'm the only one that's really qualified to answer that question, how things were before and after, because I was around, but I wasn't practicing in the 60s. Anyway, when I first started into practice, I mean, every time an 18-year-old girl came into my office, of course, I wasn't much older than she was, but anyway, it was, the question was, could she take the pill? She wanted a prescription for the pill. And the interesting thing about the pill at that time, I was unsure about it because it's not really a medical, it's not really used for a medical problem, or it wasn't then anyway. It was used for birth control. And there were problems with it, especially the early days when there was too much estrogen and people used to get more blood clots and things like that. So that was, and even have strokes. So that was pretty serious. But and I didn't think that these people would do it, but I would get that sort of thing. But I was thinking, they're only 18 and they're going on this pill, and should I prescribe it? So anyway, one of my colleagues, I said, should I prescribe it? And he said, well, do you want her to have an abortion? And I said, well, no. So then I started prescribing the pill. And I think that's how a lot of people did. And it became the easy way to treat women, is to prescribe the pill. And you could prescribe it for instance, if you had painful periods, like Miriam did, really painful, if you put her on the birth control pill, the pain would go away. And if she wasn't having periods because she had PCOS, which you probably didn't realize, if you put her on the pill, she'd probably get regular periods. And the same with, didn't quite work quite as well for PMS, premenstrual tension, all of the irritability and moodiness and things like that. In fact, sometimes it caused it. It was worse. Yeah. But anyway, it was used as a treatment for these things, but basically it was a social indication. It was used for birth control, and people wanted it. So it changed the attitude of people, of women who came in. It was almost a demand. I want this and it's my right, and please give it to me, or not even the please. And it also became an easy out for doctors because you didn't really have to do very much, just write out the prescription for the pill. And it changed the whole focus of medicine from, instead of spending a little time on what the problem was and maybe what the outcomes of, for instance, polycystic ovarian syndrome, it was give the pill, you'll look after everything, and she's set for the next year and probably several years after that. It's now used for acne. Anyway, it's used for a lot of things that young women have, irregular cycles and even irregular bleeding. So it's a very commonly used medication, and it made it easy for doctors to prescribe, and it sort of gave that the idea of not actually treating the condition that the person had, but just hiding it within a birth control pill. And the birth control pill is really sneaky because it makes it look like you've just got wonderfully regular, normal periods, and they don't hurt, you don't bleed too much, and they come every month at the same time. You can just, you're not hiding in your room for 3 weeks because you're worried about it. You know where you are. So it was very sneaky, and people thought they were just having regular periods, but basically it shuts down your ovaries. So you're not getting a period when you're on the birth control pill, you're getting withdrawal bleeding. And so you get hormone for 3 weeks and you're off it for 1, or at least that's how it was at one time. I think nowadays they have it all the way through. You're on some sort of a pill. They change. You can get pills with 2 hormones in them or with just 1. And some of them have different phases of the cycle, but basically it shuts down your hormones. So you're not getting a true period and your hormones are not going through the regular cycle. So you just get withdrawal bleeding, but it looks like you're having the normal period. And so with that, you want to know about your cycle. You want to know how things are going. You would probably like to know, most women would. but you can't really chart your cycle because there's going to be no changes in it. Like if you chart it, it's going to be the same every day, basically. It's going to be dry, and you're going to have a period at the end of it, and you probably won't have too many other symptoms. So you won't have any other symptoms to chart. So you'll just have, you could keep it on your phone, which is what many women do now, is keep their cycle on their phone. And if they're on the pill, they can see where they are, and even if they're not on it. But anyway, it gives the regular cycle. And that, to me, led into a way of thinking about, treating women's problems. Use the easy treatment. The birth control pill was the first easy treatment. And then one of the side effects of birth control pills, apart from the fact that sometimes they made people moody and it probably wrecked marriages, is that it delayed marriage because it allowed people to not bother getting married and still have sex. And which when I was younger, the average age of getting married was 21, and the average baby was born maybe a year later. But like nowadays, the average age of marriage is about 29 or 30, and the baby comes a little bit after that. And so it delays, there's all sorts of delay in that. And in that period of time, the woman's ovary is actually atrophied. It's small. It's sort of like you'd see in a woman who's postmenopausal. And a woman isn't learning about her cycle. She's not learning anything about her cycle, and she's not getting any treatment that's going to help it. So when she wants to get pregnant, which is usually around 30, if she's found the right guy yet, and that's a real problem now too, because I think often men think that it's just, a walk through life and not take any responsibility. And women think the same thing. And it's sort of unfortunate because people don't decide that, this relationship that's gone on for 10 years is, it's not going anywhere. Let's drop it. But, you've lost 10 years in that sort of time. But anyway, you go that, so your infertility your chances of infertility improve, or your chance of being infertile increases with age. And that's one of the big things. So if you start your family trying to plan your family when you're 30, you're maybe looking at problems. And if you're on the birth control pill and go off, then maybe all of these problems come back, like your endometriosis, you notice the pain, your polycystic ovarian syndrome may be even worse, and your PMS may be worse too. And then, so what is the answer for that? The birth control pill, of course. And then if you do want to get pregnant, well, we'll go to, is that hand my hand? Is my hand okay? It's if you do want to get pregnant, then you go to, the local fertility clinic, the IVF clinic. And instead of, they do look for problems, but they base their calculations and all of their testing on a 28-day cycle, which is basically following a rhythm method of testing. And so they do testing on day 3, that's baseline testing. And then they follow it up with testing on day 21, because they think that's 7 days after ovulation, which is supposed to occur on day 14. And so Maria will tell you, and anybody who's using the Creighton model, that ovulation doesn't occur always on day 14. So that method really doesn't give you an awful lot of information. And also, they're not charting the hormone changes in the cycle. So they don't have something that tells you how the estrogen goes up prior to ovulation, whether it looks good, and how the progesterone goes up after ovulation, how long or short that period of time is. That's one of those biomarkers in the cycle. What the mucus score is, that's, it's from 0 to 16. That's a big biomarker too. What the period looks like, whether there's any extra bleeding. There's all sorts of biomarkers in the cycle. And we use the biomarkers, and we also, in Napro technology, we're looking at all of these, and we're finding out the normal, and then we're charting the cycles when people are in treatment. And so we see the effect of the medications we use. And that doesn't happen in the infertility clinics, because like the pill takes over your hormones, the infertility treatments take over your hormones. And so they try and give you lots of clomiphene or something like that to make you ovulate. And they've decreased that now because it causes so many multiple births. And then hormones, pharmaceutical doses of hormones, not just replacement, but actual having a quite a profound effect on the body to induce ovulation. And then usually they continue supplementing with progesterone. Often people conceive more often than they have live births, and the conception rate is about 30% or something. So the live birth rate isn't that great either. So lots of people have nothing. Some people conceive and they still the pregnancy doesn't take, but they don't monitor the pregnancy. They monitor to about 12 weeks, and then people are on their own. And in the Napro world, I monitor pregnancies till about 30, 35 weeks to make sure that the progesterone level is staying up. Because if you've had an infertility problem, then you're liable to have a problem with miscarriage also. And so what we try and do is give medications. What we in the Napro world do is to give medications to bring the cycle back to normal, to treat the endometriosis as best we can. Sometimes it's hard because surgery is the best treatment. It's not always really available, and it's not always done really thoroughly. The patients that I've had that have had it done usually have had to travel to the States. Unfortunately, BC has a wonderful doctor that does this surgery, but they don't take any Alberta patients, and I'm in Edmonton. So it's unfortunate. I'd really like it if they did, but they don't. Anyway, trying to get the right treatment is what we do, and we base it on what we see in the cycle and the hormones that we've seen on their regular normal cycle that's unmedicated. And then we base the medications on what we see. Then we know how to treat it, as Maria pointed out. Anyway, what's happened in the world of most physicians is that people are immediately sent off to an IVF clinic, which doesn't do all of that, doesn't do that investigation, doesn't find out what's going on, probably doesn't pay any attention to polycystic ovarian syndrome, which is a really, it's actually a disease that could affect people their whole life, because it's characterized by obesity, for instance, that can lead to heart disease and diabetes, which is, a lifelong metabolic problem, and obesity. Then there's no period for a while. So it's also characterized by estrogen dominance, and that can lead to the cancers that Miriam mentioned, ovarian and breast cancer. So it can be really a serious disease. Most people don't realize they've got it. And then also lead to hypertension. So it's something that needs to be treated, and it needs to be treated hormonally so that you can balance out those hormones. But that's not often done, and most GPs sort of hand it off to a fertility care specialist to do what they do. I think that I do get referrals from some people, but most often people find me by themselves because I don't advertise. And anyway, it's I think that women's healthcare is actually really poor because of that, because we're not treated for all of the things that we have. It's treated as, we can do this, this, and this, and make a baby sort of style, but not treat the whole woman for all of the things that are going on. So I think that the pill was one way of, in a sense, not treating women for the problems they had, just sort of covering them up. And in vitro fertilization is another real good money-making way, and not paying very much attention to the actual person. It's sort of like having, get through so many spigots in a day sort of style. Like women are like a product, and so are babies. We're products. We're not people with problems. Anyway, that's what I think of the change in medicine, and it's a big effect. I guess one person, I don't know who it was, but I've seen it in magazines that the pill is one of the hugest effects on society in the last century, maybe the hugest. It was a massive effect on society, and I could see it from my little end of the world, just before it became common and after it became common in people's behavior. So that's what I'd like to say. I mean, it has had a huge effect.
Oh, wow. Well, that's yikes! quite the extensive history and quite the pickle in a situation there. I think it's very. I think right at the end there, where you're talking about how it's these Band-Aid solutions, and it's not really treating woman, the whole woman, with all the different things. And it's interesting. We have a political climate that says we are representing women very well. It doesn't sound that to me from Dr. Haggerty's answer. So Heather, Marie, I'd like to ask you before we get to questions, and sorry we're going a little long, but we'll try to get as many questions in after this. But what's our call to action? Like, how can we change the narrative to have women hear about Cretin, Napro, and any other related treatments to get to these real underlying issues and actually bring women health?
Yeah. So I'll go first, and then Maria can kind of fill in some of the gaps here. So we need to begin early. Change needs to happen early. And so as practitioners and as medical consultants, we hear so often, why didn't we learn this in school? Okay. And that's a common response. And so I currently have 2 directives, okay, that I'm working on, and it's to bring the message of fertility awareness into the school system, okay? So to educate youth on the goodness of their body and its function. So by doing that, we're already changing the narrative, okay? We're giving youth the ability to be empowered by the knowledge that they have and to use it in such a way to get the help that they need. The second part, project I'm working on is to help women advocate for themselves, a holistic care system, specific to reproductive health and treatment. So I think women and couples, we need to speak up and out about, our health. We should be offered alternative options to look at our fertility and be able to have a preventative look. Right now, our system is, it's not preventative, it's reactive. So it's like, you got something, let's do something about it. But it's not looking at, okay, you've got polycystic ovaries, you might have this in the future. No, it doesn't look at treating it and trying to, of course, solve it so that you have a better quality of life later on in life. So we want to look at that. And there's a need for us to work to change the narrative by asking more questions as women and couples. We need to ask questions and demand answers and options, and not really take medical advice at face value. We know our bodies. We are smart women. We know our bodies. We know what is good for us. And so we need to ask more questions and not just, quickly go on the birth control pill, because of course we trust our medical system and our doctor. We love our doctor and he's been so nice to us and whatever. We need to ask questions. We need to know, why would we take this in order to get and feel better? So if this is something to the audience here, if you feel passionate about what you hear today and want help and you want to make a change, please reach out to me. And you can find me at my website at integrafertilitycare.com. And so that's kind of where I think sort of the change would happen. Maria, what do you think about that question?
And just Heather, before Maria answers there, do you want to put that in the chat, your website?
Absolutely, I will. Thank you.
not too much to add from my end. I would agree with Heather on all of that. As I mentioned a little bit earlier, what your body is telling you is true, and paying attention to that is the best thing you can do for yourself. The earlier, the better. Early intervention is the best, and being well informed at a young age is good, and to empower yourself and advocate for yourself with others, and reaching out to the resources that are out there, like Heather, who can point you in the right direction, who can say, you may not be coming to Heather for charting, but she's a great resource that can point you in the right direction and say, I think you need to talk to this person, or have you considered this? There's a lot of good information out there, and this is an opportunity for women and young women.
That's
Dr.
great.
Haggerty, anything to add to that?
Oh, I better unmute myself.
No, you're good.
Am I unmuted? Am I
Yes.
muted?
We can hear you.
Oh, okay, okay, good.
Perfect. Thank you.
Yeah. Well, I think it's really difficult to do what we're doing, because it's totally against what society is doing, and probably I think personal witness makes a lot of difference. Like I remember somebody who was just a friend from one of the parents of my daughter's friends got really interested in this, just because I didn't even witness that hard that she was interested in what I was doing. People are sort of interested, and I think personal witness is an important thing. I think it's difficult to get into schools, and you really have to be professional when you go into the school, otherwise they'll boot you out, sort of style. So, but it's a wonderful thing. The other place that some of the Americans have done is they've gone into seminaries, and they've gone into universities, like talking to medical students, or to a youth club at the university, things like that. I mean, it's great to do it young, but when you're really young, you're not that interested in all of these things that are happen. You might be interested because you've got pain, but you may not be interested in anything else. But I think as you get older, you might be more interested. Anyway, I think what you're trying to do is wonderful. And actually, this is a great format. Imagine being able to stay home and go to a conference. It's pretty good.
Well, if we're lucky, maybe we can have a conference in person again one day, but we'll take this for now. Yeah, this is great. And, not to steal Annabelle's thunder here, but that's kind of the purpose of the YP Lounge, is to hear from these people who, well, frankly, are kind of standing out on their own in society, kind of going against the grain a bit. So like Heather said, if you're, whether you're looking into creating a Napro for yourself, or you're just genuinely like, no, I think this is something people need to know, reach out to her. She's put her site in the box, so hopefully I didn't just flood you with a bunch of requests, Heather, but I'm sure you'll be okay taking those on. So we got about 10 to 15 minutes here we can probably take for questions. The floor is to the rest of the people on this call here. If you have any questions for Heather or Maria or Dr. Haggerty, please, by all means, bring them to the table.
Maybe just one question then from me. I was wondering, could you compare the availability of Napro technology services as healthcare providers? How available is it across Canada? Can you compare BC, Alberta, and so forth? What's the medical system like in all these other provinces across Canada?
Maria, that might be, yeah, go ahead.
it's not very available. It's difficult to, I mean, it's available, but you really have to look for it. I don't know if Maria advertises. I don't. And I still get patients that come in because I also do a family practice. So anyway, I really enjoy the practice, the Napro practice that I do, because I enjoy all the patients. But, you know, they have to work to find me. So actually what I'd like to do is establish something in a hospital so that it would be like a Catholic hospital, so that there'd be an alternative for people that are looking for infertility workup.
So, yeah, in terms of other practitioners, like, so there's, you know, Dr. Haggerty and I here in Alberta. There are several doctors in Ontario that I know of as well. The United States is chock full of Napro technology medical consultants. And it's just you know, it's a program that was started in the United States under Dr. Tom Hilgers back starting in 1978. And, you know, so some Canadians have been involved naturally. But also keep in mind that our medical systems are very different. And so the socialized medical system does not make it as easy to provide this type of service, whereas the American system is very much more open to cutting edge technology, to cutting edge programs, things that are different. What can make, you know, what can make your health better, preventative health, healthcare that can help to heal. They have a very different mindset in the United States. And I think, you know, with Heather, Dr. Haggerty and myself, we all trained through the Institute, through Omaha, Nebraska. We have experienced that difference. And I think that difference is actually what gives us that drive up here in Canada to really do something different and effective that works for people. So for myself, I have, I do Napro technology full time. I am that busy with it. And so I have a website, which is fertilitycarecanada.com. So it's available to all Canadians. And so that's how I reach out to people. I did not reach out up until this year on a website because I like Dr. Haggerty, it was always word of mouth. You know, the service speaks for itself. The success rates, I should say, are, you know, our success rates are very good with fertility, anywhere from 70 to 80% success rate versus 21.3% for the IVF programs. So the charting itself, actually 20 to 40% will achieve pregnancy with charting alone if they are infertile. So it's kind of a no-brainer. And I think once women catch on to that and understand, wait a minute, I don't have to take anything. I can just watch what I'm doing with my body and it'll work for itself. You know, they're very empowered that way. So anyway, yeah, there is availability. It varies. There are practitioners, you know, it's an online world. We can see anybody across the globe. So if you are not right in Vancouver, where Heather is, no worry, you can be from small town BC or, you know, Alberta, Nova Scotia, wherever it is, and tap into the charting or even, you know, with telehealth, telemedicine. I've been doing it for 10 years online because as a pharmacist, I had that flexibility. Physicians don't have as much, or at least didn't used to before COVID, the ability to do a lot of telemedicine. So the world is a different place now. The access is much better. And so I think that is in our favor and in women's favor.
By the
Maria?
way, I'm not somebody that actually likes telemedicine because I don't feel I can do my patients very much good if I can't examine them. I mean, people come in to see me and they say, well, I've got such and such. And after I examine them, they say, no, you don't. Because you can't always tell by what people tell you is wrong. I think you have to, I think that telemedicine for me is not it's a poor way to practice medicine. It's possible to do the Napro technology because I don't actually examine my Napro patients usually unless they are my patients. I leave that to somebody else, but I can order tests. But generally, I'm not in favor of medicine being practiced online. I think it's a hoax, but anyway. I mean, I think it's poor medicine, basically.
Yeah, fair enough. Well, we've kind of been forced to telemedicine in a lot of ways with COVID, so it's
yeah, we've practiced all the way through it. We just took precautions.
Yeah.
We weren't set up to deal with COVID patients, so we always questioned, but we always wore masks. We still do. I wore protective clothing, and we're careful of washing hands and things like that. So none of us, no one in the clinic has gotten COVID, and we've been seeing patients all the way through.
That's good. It's great.
Yeah.
Be able to still get that service.
I hope it carries on. I hope I'm not speaking, that I don't get COVID next week or something.
Well, yeah, let's cross the fingers and all that. But I think, take the precautions what you can, and that's all you can really do, right? So we had a question here in the chat from Rosanna, who wanted to compliment Dr. Haggerty and Maria. She's seen you guys in the past and thinks you guys are great. So that's always good to hear. And she would like to know if there's some general comments about Napro could be used in the premenopausal years, mostly to manage illness issues. And Dr. Haggerty, I think you sort of answered in the chat, but if you want to expand maybe for the rest of the group here.
Yeah, what I said is that if there's medical issues, then you should see your healthcare practitioner or go online with them if you want to, and sort of find out what the issues are, and especially somebody like Maria or myself who can be your healthcare practitioner, and address not only the illness issues, but also see if there's anything related to the menstrual cycle, if it's perimenopausal. I mean, I think it has to be done in conjunction with whatever else is going on in your life. So it might mean two practitioners. It might mean your general practitioner and somebody who can give you some information about not infertility, but hormones as you get older. And actually, Maria would be excellent on that because she's a pharmacist and she knows all of the medications. I only know a few of the ones that I prescribe. She's an expert in medications and what should be used.
Okay. So another question here from Maureen. Many young girls are having early periods. How can parents be informed about how to guide their daughters? I'll let Heather, Maria, or Dr. Haggerty, and anybody want to tackle that.
Do you want to tackle that, Maria?
I was sort of hoping Heather or you would.
Me? Okay. They're having earlier periods, and I think there's a lot of environmental factors for that, as well as just hormonally. I think it's hard because you want to do the best for your daughter. If you don't have the foundation of charting yourself, that can also be a challenge. So I think the first step is sort of learning it alongside your daughter. And so being able to understand your signs of your body and be able to use it as an example and actually teach it to your daughter in an accurate way. And so you can teach it, help guide her, help understand what her symptoms are, and then, seek out the help they need, either to see a medical professional to, look deeper if this is endometriosis, if she's dealing with polycystic ovaries, whatever it might be. But walking alongside your daughter with this, and I think being as dedicated to it yourself will help as well. And obviously reaching out to a practitioner who's experienced in teaching, could help guide you for sure. So it would just mean reaching out to someone who knows best. And Maria's gone through it herself. Thank you, Miriam, for sharing your story. That was really amazing. You have an amazing mother. Wow. Was there any other?
Yep, we just got another one here from Angeline. Is there a directory of medical professionals, especially family doctors, who promote fertility health planning in Metro Vancouver? And guess where could you find that?
No.
No.
The question is just no. There is no directory. We have challenge here in BC. We have an uphill battle when we want to try to find out what might be going on with our bodies. And so in that preventative measure, which of course goes back to my second directive, which is to help women advocate to get this help. We get a lot of help in different ways with different things, but they're kind of pharmaceutical based, and there's some kind of money coming in here and there. That's a bit on the sketch side of things, but we want to, we just really want to, we want to inspire the generation of younger people to know their body, to advocate for themselves, to train in the medical field and be passionate about giving alternatives, because like Miriam, she would not have a way of life, a wonderful way of life, if it wasn't for this. And so getting these young people at that young age to kind of see that benefit is going to make that change. And also it becomes an issue of, if I get enough people to yell and scream, maybe we can make some change. And unfortunately, our doctors are put in such a hard position, because they are threatened, they are flagged, they are, and so, and for what? To help a woman with her underlying issues. So there are uphill battles with the medical system in BC, in Canada, that we want to invoke change with. And so in the simple answer, no, there is not a directory. However, we do encourage you to ask your regular physician. We want the physicians to know and be aware that women want more. Okay? Because if it starts coming to the doctors and the doctors say, look, they go to their boss and they go, look, these people are not happy. There's complaints, there's whatever, what can we do? And so we want to sort of invoke that. We want to advocate for women. We want to empower women to ask these questions, to make changes, to get these doctors to listen, right? And so that's kind of where we're lacking with the medical system in treating women, and where we kind of want to see it. So without rambling too much, which I already have, no, there are no doctors that will openly help you in this way. We can find doctors who will participate. They don't have to be Napro specialists, but there is the odd doctor who will sign off on it. Okay. And so we just encourage people to ask their doctors. If they don't be discouraged, and we will look again. We will try our best to get the help that you need.
I'm sort of interested to see Dr. Haggerty's opinion on that, and what is the best way to approach these young women to approach their doctors when they want to be assessed, they want to know what's going on. And what's the best way for them to approach their doctors, and what should they say to them so that they can get the results that they want?
The problem with being assessed, they can be assessed for some of these conditions, but so often a regular doctor, instead of dealing with it, would send them on to a specialist. And the specialists aren't really that great at dealing with general medical conditions, but they're really good at, starting somebody on a birth control pill or something like that. So are GPs. I think it's really difficult. especially with doctors that haven't been trained in doing this, because, people ask me, what does this mean? And they don't understand, how to interpret things. And so it's a challenge, but it is a good idea to ask your doctor, about this, because it brings it to the forefront. I remember when, they started talking about, the Chinese treatment for pain. What do you call it? Acupuncture. I mean, that used to be not looked at as very great. And then it gradually got a little bit of exposure, a lot by patients, who came and would see the acupuncturist, the one in town, and be really happy with the results and come back and tell their doctor. And gradually that got to be very common. So I think that it is really important what you're saying, Heather, to advocate for yourself and to ask.
Yeah.
And I just wanted to jump in. Oh, sorry.
Yeah.
Sorry, Nathan. I just wanted to jump in that the second part of the Young Professionals Lounge is to develop a series of different verticals of professions where we would have mentors who are willing to walk beside mentees who are interested in various professions that directly deal with building a culture of life. I just remembered that Dr. Mary Ellen Haggerty had mentioned that part of her dream is to develop a hospital of sorts where there would be specialized training and treatment that would make fertility issues much more more natural, I guess. Looking down the road, Mary Ellen, how do you foresee inspiring young people, and can you foresee using a platform like the Young Professionals Lounge to inspire young people to want to go into this field, either as a fundraiser or physician or whatever?
Yeah, I'd really like to. I find my work as a general practitioner is really time consuming, especially nowadays. I think because there's less people working, and so the people that are working are more burdened in terms of the people that we're seeing. So, I mean, I got to work at 7 this morning, and I worked till 4:30. I took half an hour for lunch. So that's 5 and 4 is 9 hours. It's a long day, Anyway, that's the way my days are. And I could have brought work home, but I didn't because of this tonight. But anyway, it's quite challenging. What I'm planning to do is retire soon and just do Napro technology for a while and write up all my cases. That's what I'd like to do. Present them to a hospital and then maybe get, set up something in the hospital. But I haven't been able to do the work that you need to do that.
Well, it's a great dream.
What's that?
It's a great dream to have, and
it's a good dream to have. If I live long enough, maybe another 25 years, I might be able to do it.
So it sounds like there are a lot of political challenges in getting this field of scientific research and treatment to have solid roots here. And I think Heather and Maria had hinted that there are different ways that we might be able to have the medical system change. Can you cite any other factors that might be a hindrance to having this field flourish and grow more?
Is that for Maria to answer?
It's for anyone, I guess. Heather or Maria, or you?
I would say that's the biggest one. The medical field, I think, is the biggest because they have to be able to allow that as an alternative, like acupuncture, like they had said, for it to be a recognized form of treatment that can be billed to your insurance, right? I think we need as women to kick and scream until that is something that can happen. And I think it is doable. I think we can make a change for getting this kind of treatment. And I think if there was a little bit more education, physicians have a lot on their plate. They do a lot of work. Like Mary Ellen had just said, it's a specialty doing this Napro technology. So not everyone has that time or that commitment available to them. And so when, you know, if this is more well known, if more Catholic doctors were open to it, if there was the ability to practice this openly, we could have more foundations. We could have that ability to treat women in this way. But it kind of has to start with us women. We have to kick and scream for help. And if we don't get it, then, you know, I mean, that's a foundation, right? To make change, we have to ask for it.
Yep, we are entitled to have our choices. And, you know, that it's important that we have a choice in our reproductive health in this way, that we want to restore it to normal, that we want to have a better quality of life. Those are very, very valid things. And it is a challenge in our socialized medical system. And I do think that it is a broken system. I don't think it operates very well. I think that women don't have timely access. They don't have accessibility to the help that they need very easily. And I think that it does have to change. Something needs to change somewhere, because in the United States, if you want Napro, there is no barrier to it. All you need is somebody, you know, who is willing to do it. If you go to a doctor who may not be a Napro doctor, they seem more open to doing newer things that, of course, don't do any harm, but may bring benefit to their patients. So I think that the mindset, the medical mindset, and the mindset of the women out there has to change.
Yeah, some great call to actions there. So again, everybody here on the call, if you guys are inspired by anything you hear, reach out to Heather, keep in touch with Annabelle. That's her job, is to build that pipeline. So because it sounds like you know, there's some great stories of healing and great accomplishments, but not a lot of resources right now. So if it's okay, we can get maybe a couple more questions in, and we'll wrap her up tonight. So one question that we have here from Maureen again. Pro-abortion supporters seek to protect women's reproductive health. How can we work with pro-abortion and pro-choice persons to support women's reproductive health in additional ways? So essentially, is there an alliance to be had? Because obviously a great deal of what you do is not necessarily against their political worldview. Have you tried? Is there kind of anyway, I'll let you answer before I throw a million other questions out there.
No problem. Yeah, that's a great question. And it's in the works, right? It's one of my things that I'm working on. It's a slow go, but I'm on it. That's exactly it. This is something that we can reach out to every single woman, and she will say the same thing. Yes, I have not been listened to. Yes, I would like alternative treatment. Yes, I would like to not be disrespected or yelled at by my doctor, or, you know, there's always something that can be better. And any woman, any creed, any religion, any nationality, any stance, pro-abortion, whatnot, we can all be on the same side. And this is why I think it could work, and it could be something that could catch fire and affect change. And so, yes, we want to welcome women of everywhere, pro-choice, pro-whatever, and allow them to be part of this. This is a movement for all women, no matter what.
That's good. And now we have another question here from, I think, Melissa, just asking for some clarification. And the treatment in Napro offers analyzing after charting, etc. you mentioned individualized hormones. Do you prescribe estrogen or progesterone? Sorry if you had already explained this, but still unclear. If Maria or Heather or Dr. Hager, you want to take that?
I think we prescribe both of them according to what the chart looks like and according to the symptoms. More often progesterone, but sometimes estrogen also.
Yeah.
Maria could maybe answer more. I don't know.
Yeah, those are two very common things. I would say, isomolecular hormones are what we deal with. They're called, in layman terms, bioidentical, meaning that they are the same chemical, the same hormone, chemically speaking, that we are prescribing. That way, it's not causing those side effects. It is accepted by the body. The body recognizes it. And that's why we don't see any of the problems associated with them, and why women feel so much better when they are restored. So yeah, and there are commercially available products for those. There are compounded products for those. It really depends. There are other things we use which will help with the production to boost your own production of your hormones, like HCG. That is one other thing that we use, but always working cooperatively with the body at the right times, giving these hormones at the right times where the body would expect to see them. Because if you give them at times that are not cooperative, not where they're expected, then it's going to throw the cycle off and actually make you worse. So that's why women need to surround themselves with those practitioners or medical consultants who are trained and who understand. They are trained in chart recognition. So they can pick out where the issue is in the chart and exactly what needs to happen in terms of treatment accordingly. So.
Well, great for clarifying that. So that does it for direct questions. There's been some chatter here about if the Catholic Church can get involved in helping out. Again, YP Lounge is not an officially an organ of the Archdiocese of Vancouver or any archdiocese. So, but by all means, if you can find allies there, I'm sure I'm sure you could push some things along, and maybe that could be an instance. But we can't really offer a comment on that. So I think that's, yeah, like I said, it for questions here. Oh, we just got one more. Oh, yeah. So again, coming back to that question about IUDs and the church again, but we can't make a statement on that because we're not a church organization. But so we'll have to leave that there. So with that, I think I want to thank Heather and Dr. Haggerty and Maria. Miriam, I don't know if I see her on the call, but that was a wonderful testimony. Thank you for sharing that. And Annabelle, I'll hand it back to you.
Thank you, Nathan, for stirring this evening tonight. Of course, thank you to Heather and once again, Maria and Mary Ellen, of course, Miriam, for providing a combination of scientific information and giving us a broad sense of how this Napro technology can assist the average person and even women in general who have difficulties with their reproductive cycles and such. I think this has been a great evening. I'm so thankful that you could join us. And for anyone who is interested, we would be able to circulate this recording for the records, and so that they could sort of listen to it over and over again and pick up the salient pieces that are important to them. So once again, fantastic. Do keep in touch with us. You know where to find us. This organization, the Young Professionals Lounge, is part of the program under Vancouver's Life Community, which is now a chapter organization under Life Canada National Association. We've all merged and reorganized. And of course, supporting us is always important. We aren't able to produce these programs without you. In fact, we do it in cooperation with you. So do keep us in mind. We do have a new website at yplounge.ca, so do check it out and stay tuned for our next spotlight. So thank you again, and good night, everyone.
Thank you.
Thank you so much. Bye,
Good night,
everyone.
everybody.
Bye.
Bye.